Hi, everybody, and welcome back to our road trip to wholeness through South Pass Wellness. I'm Althea. I'm so glad. I'm so glad that you are joining me here today. As you can tell, I'm not in the office today. Last week was quite an adventure for us, and so I had a couple of days that I could take and just kind of recover, which is a good thing. Last Thursday, my husband had a little surgery, which is one of the reasons why I didn't do any videos until now. He had a little surgery on to remove a mass from his kidney. Now, this is interesting, okay? So, I want to kind of talk about that today because it gives us kind of a good perspective for emotional wellness, right? So, joining me again, of course, is your Feelings Buried Alive Never Die book in Under Kidney Problems. Here are some things that Carol Trueman has discovered that is kind of some things to work on emotionally. So, kidney problems: extension of bladder, but only more severe, insensitive to situations where caring and concerning should be exhibited, trying to control life, being overjudgmental, feeling emotional confusion, deep subconscious resentments towards people and experiences of the past, unfounded criticism of others, and repressed emotions. Now, why that is quite a bit. I mean, let's talk about that for a little bit because there is a few things in there that generally apply to kind of this wide spectrum of our life, right? And I think the biggest one is the deep subconscious resentment towards people and experiences of the past. And then the next one would be unfounded criticism of others. I want to be able to talk about those two because even I do that, right? I know that in the past, and still, I still criticize unfoundedly, whether it be of somebody else or of myself, because, well, as you're learning to work through it, it does take effort, a lot of effort, to be able to stop when you are doing that and recognize that that's what you're doing so that you can stop that behavior from progressing. So, using the emotion code helps you be able to take care of things that have been in the past so that you can feel different about it, so you can make better choices today. But it's still a very conscious effort on our part to really be aware of what's happening in the moment so that we can then stop it from progressing further. And it was interesting because I was listening to a little broadcast from Tony Robbins, and it is one of his older shows. Let me get my little note here because I think it's important. And he said that one of these things have to go in order for you to get where you want. It's got to be a fear, an emotion, a skill, a limiting belief, or a habit. I thought, you know what? That's actually very, very accurate, right? Very accurate. Because one of those things are what is holding us back. Kind of like our ability to criticize others that is unfounded. There's lots of times when we look at people, our friends, family, people on the outside world, and we hear a little bit of the story and we already start getting that, like, oh, they've done this, they should try this, they should do that, if they'd only see it this way. And honestly, like, none of that really helps because, number one, we can't affect or change anything in their life. They have to be the ones to do it. And also, even if we do try to interrupt or involve or take it from, we really only delay their experience or ours, right? Because, well, when we tend to blame, like we were discussing last time, when we tend to blame other people, then there was one person who said, I think it was actually Tony Robbins, who said, if you're going to blame everybody for your mistakes, you have to blame them for all of your successes too. Makes sense. I mean, because as much as I would like to believe that I am right 100% of the time, I know that's just not true. And so being able to work through a little bit of that, using the emotion code so that we can keep the balance in our personal journey, is really what it's all about. So, one thing that has happened since the husband's surgery and we got home and all this kind of stuff, I all of a sudden now have developed a pain in my left knee. And so I thought, well, now is the perfect time. We'll just look at this. So, Carol Trueman again. Left knee problems. Needs to be more receptive to events, feelings of insecurity, experiencing unresolved stress. Yes. I am going to definitely say the feelings of insecurity and the unresolved stress because, quite frankly, like, you know, anytime you go in for a procedure or you have somebody you know going in for a procedure, it is stressful. One of the things that was happening that was kind of very stressful for me was the fact that when my husband was in the last part of the recovery room, because you have the operating room, recovery room, and then the post-op. So we were in the post-op waiting to just kind of do the checks and balances, and then we could get out of the hospital altogether because, of course, it was just a day surgery, thank goodness. One of the things that started happening was his blood pressure started going boop, 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 boop. And I'm like, okay. When we come in here, he didn't have blood pressure issues, right? And so, of course, when the doctor came to talk to us, then I asked, I'm like, is this something that I need to be concerned about? Because it's like, I was a CNA, which gives me enough knowledge to know what the signs are to look for the bad stuff, I guess. It doesn't give me the full extent of a knowledge of a nurse or a nurse practitioner or a doctor, but it does allow me to at least have some insight on how to be like, okay, that's concerning. And also it lets me know that, you know what, this isn't something we're going to mess around with to the hospital or to the doctor we go, right? So the doctor comes in, he sees the blood pressure. I ask him if this is something I need to be concerned about. And he's like, well, was he on blood pressure medication? And I'm like, no. And, you know, sometimes this is one of the challenges too, right? So my husband takes a multivitamin called Protandim. And it was a multi-level marketing business, but like this Protandim has helped him. He's been on it for the last 7 years. And seriously, like it is just, I mean, I think he's been sick with the flu twice in the last 7 years. Like he has just been healthy. And so his age, I mean, he's almost 60, but every time we go in, the doctors are always like, okay, let's go over your med list. And we're like, we don't have one. And they're like, are you sure? Are you sure you don't have any medication? None? And it's like, no, he doesn't have any medication. And I mean, because like using the emotion code as soon as I got certified, that kind of helped put us on a much healthier path, right? And so, of course, yes, we are paying attention to our emotional wellness. We are paying attention to it more than normal just because that is what I do now. And so we want to make sure that we're always having a healthy balance, or at least we're working diligently to obtain a healthy balance between emotional wellness, physical wellness, blah, 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 all this stuff, right? And so they always look at us like we're lying to them that he doesn't have any medications. And then the funny part is like if they give you a medication and you go to the pharmacy, because of course he got a pain medication, so we went to the pharmacy to get it filled, and they look at you like you're a drug addict. So it's like, okay, you know, so it's kind of this weirdo stuff. So unresolved stress, yes, I do have unresolved stress because like trying to coordinate everything, I realize it's one of my patterns that I do in particular, again, has come to the forefront, is that I do everything I can to make sure that like literally he has nothing to worry about. Like he has no stress. And so in doing that, it puts a lot of stress on me, I realize. But then I get into this, I don't want to say it's quite resentment towards the situation or to the people involved, but it starts making me feel like, seriously, like, you know? So one of the things that I thought that we could do during this particular video, since there is some insecurity, And I will admit, like, last night I did get up from after we went to bed, and I did work on my knee pretty good because it just, I don't know what I did, honestly. I think I was just walking along and bam, there it goes, which is usually how things go with me, you know. So I started working on it last night, and it's a very, I can put my finger on the pain in the knee. And so I have resolved or have removed and let go of quite a few different things according to the body code, which I'm not certified in, just the emotion code, but I have the body mind maps on my iPad. And so I wanted to be able to just like go through this, and we'll see if there's any what is causing the unresolved stress from the emotion code perspective. So if you bear with me for a little bit, I would like to just go through there. Okay, so energy testing these questions for my body to see what it is using the emotion code. So I'm just going to ask, first of all, is there a trapped emotion that is causing unresolved stress? Yes. Is it in column A, column B, odd rows 1, 3, 5? Is it conflict, creative, insecurity, terror, unsupported? Yes. I would agree with that. Do we need to know anything? No. Okay, so we're just going to use the governing meridian. If you would like to know more on how to do this, please look up Bradley Nelson. He will gladly explain how it all works much better than I could. Did we release that? Yes. Is there a trapped emotion that is causing unresolved stress? Yes. Is it in column A, column B, odd rows 1, 3, 5? Is it conflict, creative, insecurity? Yes. Do we need to know anything? No. We're just going to remove this. And did we release that? Yes. Is there a trapped emotion causing unresolved stress? No. Is there a hidden trapped emotion causing unresolved stress? No. Okay. Now, I can still feel that little pain, and so it's probably going to take a few more. Of course, I'm going to be aware of that, like, because the knees are a major component in the body, right? And if you can't use your knee, like, that's a problem. And I don't want this to get out of hand. So I will be putting some ice on it. I will be doing all of that kind of stuff to see if there's anything I can do to, of course, help it. And then, of course, I'm not afraid to go to my medical provider if I need it, because, well, that's what they're there for. So in this, like, looking through and hearing some of the stuff that is about the kidney or even the left knee, and looking at the trapped emotions that were removed, the unsupported and the creative insecurity, do those sound like something that you would deal with? Do any of those things sound like something that you're currently dealing with? And can you actually deal and resolve them before it gets to the stage where you're having kidney problems or knee problems? Yes. Yes, you can. You don't always have to wait for a physical manifestation in order to work on the emotional part. I think it's something that you should do on a regular basis. I do work diligently at keeping up on emotion coding for myself. It's easier and honestly, like, it keeps me feeling level. And I mean, do I still have emotional upsets? Yeah. Do I still take things personally? Yes. But as I progress through this is what this road trip is all about, is learning how to be aware of what's going on and stopping it from progressing into further patterns that I am working to overcome. So I'm glad that you were here today. If you've enjoyed this video, please like and subscribe. I'm so thankful that you are taking the time to view it. And I hope that this helps you maybe understand something that you need to address, or maybe you just enjoy watching the journey that I'm going on. And it's okay either way. And I'm glad that you are taking the time. So please, if you want to make sure that you will never miss a video, you need to make sure that you subscribe and hit the bell so that you can always be notified when my videos come out. Don't forget to give me a thumbs up, because of course it helps put me further into the algorithm that may be able to help other people along the journey or invite them to join us. So until next time, enjoy your road trip to wholeness through South Pass Wellness, and we'll see you next time. Bye.